focus on quad and hip flexor mobility to help alleviate knee pain. So most of the time when we do have knee pain, it is because we are imbalanced in our hips, and our hip flexors are too tight, and our quads are typically too tight and overactive. So we already addressed the overactive calves, which sometimes add to the problem of knee pain, but now we're going to address the hips. So we're going to prevent ourselves from being in this position and learn how to open up our quads so we can be in better posture and create some space for that kneecap. All right, so the first one, this is the most basic. We're going to roll our quads on the foam roller. So you're going to go ahead and just position yourself on the ground, just above your knees on the roller, and your forearms on the ground. For this, make sure you don't want your back arch. Do not be looking up. Keep your chin down and keep your core tight so your back is in a neutral position. And you're going to work on rolling just above your kneecaps, all the way to the top of our hips, and back down to our kneecaps, nice and controlled, trying to relax our quads. So as we do this, we can rotate our feet in and out at different times, trying to find different spots in our quads that are locked up. Also, we can work on bending our heels back if we do find a knot and work on those pressure waves over those knots in our quads. We're gonna work in the IT band roll up with the foam roller. So you're gonna sit on the roller, and then whatever side you're trying to get, we're gonna gently slide to. Put your forearm on the ground, the other hand for support. Extend the bottom leg straight, bend the top leg over the top, planted, and making sure that we're slightly angled towards the ground, your body's in a straight line. And we're gonna work on trying to roll all the way from our hip to our knee. Make sure we keep a slight angle forward, because we're trying to stay on the IT band / quad, all the way to above our kneecap, and then back to our hip, nice and controlled, trying to find any knots. And if you do find a knot, try to kind of roll into it a little bit, take your time, work those knots out, and wait till that pain normalizes a little bit. Really spend some time trying to get all the way just below the knee and back down, because we really want to work out those tendons and open up some space. So for the IT band, mobility stick is key. Something you keep in your gym bag, your locker room, super easy to keep in the car. These are awesome for keeping your IT bands open. So if you have a lot of knee problems, I suggest you go check these out. This one's a lot more intense. It's called the MFR stick from Perform Better. It spins, it's a fine metal point. So first what we're gonna do to get the IT band is you're going to relax your leg, keep it straight so your quad is relaxed, and we're going to try to be on a 75-degree angle, so part quad, part IT band, and you're really going to push and dig in and focus on the bottom quarter of our IT band. Because chances are, if you have any of that knee pain around the bottom from the jumping or usually around your kneecap, chances are it's coming from the bottom of your IT band. So keep it at that 75-degree angle and push in part IT band, part quad, and work that bottom quarter. And we can actually, as you do this, you can go sideways, so just IT band and kind of top of the quad. Make sure we find the parts where they meet. Try to break up some of that fascia and really push in. So this one does hurt a lot. It's a lot finer point, but it gets work done. So really focus, pushing in, digging up and down on this. We can start to work up a little bit higher as we keep progressing with the mobility stick, and you should really create some space in that IT band. The next one is quad smash with the barbell. This is by far my favorite mobility exercise in terms of soft tissue work for the quad. It really digs in there, you can really relax your quads, and it lets you open up some new space. So all you need is a barbell and something to support your back. You actually don't even necessarily be able to support your back, you can just sit up. What you're gonna do for the leg we're trying to get, you're gonna keep it relaxed, barbell's on the same side. Go ahead and slide that barbell on, you're gonna hold the inside so just the sleeve is on your relaxed quad. Keep your other leg bent, you kind of hang on to it to make sure you stay relaxed. And you're gonna roll the bar up and down our quad, all the way from the top to bottom, up to our hip flexors, down our quad, all the way to just above our knee, but don't hit your kneecap. And you're gonna relax your quad. You're gonna find there's gonna be some knots. This does suck. Work those knots up nice and slow. And if you want to add some extra pressure, you can push into it. Or if the barbell is too heavy, you can go ahead and switch a little bit over and take a little bit of tension off with your hands as you roll up and down if it's too heavy. But really work on letting that dig into your muscles and relax. This you want to spend some time doing. So 3 to 4 minutes on each side. Really try to reset some of those fibers. So for the next one, take a lacrosse ball and a wall. We're going to work on digging into our TFL and up into our hip flexors. Simply pin the lacrosse ball against the wall into the side of our hip. We're going to work on rotating into our hip flexor and back into the side of our hip muscle. So make sure we're trying to find that pocket up in our hip in terms of where there's muscle tissue and not bone. We're just going to rotate side to side, push off our back leg, dig into that, and rotate side to side. We can also use the lacrosse ball too to get into the IT bands on the wall if you want to pin if we don't have a stick that we can work with. So you can pin this on the wall and rotate side to side trying to get into those IT bands. You can actually feel a little bit more of a flip with lacrosse ball mobility too, so I'll give it a try.